At Texas Health Resources, we are working outside of our hospital walls and going upstream to try to address issues that result in poor health outcomes. What we see right now is that our emergency room is often where homeless individuals come to seek care. Medical respite allows us to prevent people from being discharged to heal back in the streets.
Austin Street's been providing safe shelter and meeting the basic needs of some of the most vulnerable homeless who are in our community. We would see so many people that would come to the doors, recently discharged from a hospital, but still needing a lot of care and support. We have a lot of folks here at Austin Street that have chronic health conditions, really 60%. When you combine it with half of our population having a mental health condition, creates real challenges for people to be able to recover. So we said, okay, well, what if instead of doing things the way we always have, which leaves a gap in care for many people, we tried to close that gap by making sure that we have medical services on site with an emergency shelter provider. And that way someone could leave the hospital, get directly not only connected to shelter, but also be on the journey to end their homelessness altogether. So as we work with Texas Health, we've got a medical clinic that we have that's available for our medical respite clients. We've got separate quarters for men and for women, specifically for those that have significant medical needs.
There's so many more challenges that makes them so much more vulnerable to having increased health complications. If they're out in the street trying to keep a wound clean, trying to recover from surgery, trying to keep their medications. A lot of people, get their medications stolen and aren't able to be compliant with their medical care because they're just out there in the street.
I was banged up pretty bad, as far as I couldn't talk, I couldn't think, I definitely couldn't walk, and I was hurt really bad. And if it hadn't been for this program and these people, honestly, I don't know what the outcome would have been.
Everybody's challenges are so different, and it's just getting to know them and understand their story and where they're coming from. We talk about everything from diet to just how the disease process works and how to better care for things. And our focus is really just targeted towards how do we set people up to be successful when they're on their own? Can you manage your own medications? If you have wound care needs, do you know how to take care of them? If you have an emergency, are you going to recognize when you're getting sicker and go to the hospital before it gets really bad? It's completely life-changing. We've had people just really start at rock bottom and are now in housing and thriving.
They have gave me the hope and the motivation just to keep pushing. We can do this, and I believe, I believe it's so.
Texas Health is really interested and open-minded about how to solve problems together.
It's what we do in improving the health of the communities that we serve.
To be part of an organization that actually wants to find a solution to those things and is willing to put in the time and effort and work and funds to make that happen, I'm so proud to be part of it.